If there's a core buildup and a crown listed on the treatment plan, I don't say things like, well, your core is going to be this much and your crown is going to be this much. I basically combine the fee for both into one. I'll say something along the lines of, for the cap that needs to be placed in the upper left area to prevent further fracture and to prevent the root canal, your out-of-pocket is going to be so and so. So let's pause here. You're probably wondering, what about insurance plans downgrading white fillings to silver fillings, or all ceramic crowns to cast metal crowns? There are plans that cover composites to the first bicuspid and then not on the second bicuspid, and then they're only downgrading ceramic crowns to cast metal crowns only up to the first molar and not on the second molar. I never get into these details. By getting into these details about downgrades, you're actually confusing the patient more. Put yourself in the patient's shoes. Your patients are still trying to process the information you've been going over with them in the past few minutes. First, the presentation of the treatment plan, now the financing of that treatment plan. Now you're introducing nuances and details of their insurance plan and explaining to them why their out-of-pocket is different on one tooth versus another, or why their out-of-pocket is different for a 2-surface filling versus a 3-surface filling. It does not matter to the patient as much as you think. You think by giving all these details, you're helping the patient understand about how much all of this is going to cost. It's actually the opposite. Even after simplifying this entire treatment plan like we've just discussed, some of these patients are actually going to forget what they're coming back for in their next visit.